Where were we? Magnetic resonance imaging.
Never had that.
Ah, good. They used to call it nuclear magnetic resonance, but they changed the name.
Oh, I have had that.
The sample of the tumour that was taken during the operation now appears to be a very aggressive grade of cancer, which has even gone so far as to invade your bone marrow, causing it to stop producing blood cells. Dr. Horton, our consultant hematologist, is even now discussing your case with her colleagues at the General Hospital. And I think it's highly likely you'll be transferred to their unit. If that is so, Linda, you couldn't be in better hands.
She wanted me to tell you.
No, I'm glad you did. I'll go to the ward as soon as I get off. What about you?
Me?
Well, you shouldn't be blaming yourself.
Well, maybe I wasn't just trying to give her a hopeful prognosis. Maybe I was actually trying to show off.
Well, I'm sure Linda isn't going to care whether you were showing off to her or not.
I didn't mean her.
I had to pull a few strings, but we look after our own, Phil.
Look after number one, you mean?
And believe me, Phil, I had no inkling.
And if you had?
Ah, Adrian, many thanks. I see no alternative to gastrotomy.
The surgeons will spare your blushes once again, Graham.
I leave it in your capable hands.
Will you be wanting me to assist you, Mr. De Vries?
I don't think so. I do prefer my patients to survive. Nothing up my sleeve, ladies and gentlemen.
The nurses said you're having to tell Tom he can't visit yet.
What am I supposed to tell him? 1 minute I'm told I'm cured, the next...
Let the doctor speak to him, Linda.
If you do too.
One has a minor operation for varicose veins. One hardly expects to get a letter like this.
I do understand, but please, keep in mind that the chances of your test proving positive are vanishingly small.
He's the one, isn't he? I'm sorry, I have to go. Oh, thank you, Mr. De Vries.
Pleasure. That's the 4th patient this week I've had to cosset. Patients of yours were having to back test.
I trust you explained it's more to do with public relations than any clinical risk.
Still, there's been a change. You won't be gassing for my routine lists anymore. Lucky you, eh?
Who's taking over?
I'm not sure.
But whoever it is, as long as he's not gay or HIV positive, right? How's Dad?
He's fine.
Good. Glad you're both well.
How are you, James?
I was thinking of coming home for the weekend, actually. Didn't realise it'd been quite so long.
Is there anything wrong?
I just wanted to be somewhere where I didn't have to put on a happy face.
I mean, it's in our genes. Stress increases the libido. And surrounded by death, nature wants us to make more babies.
If it's just this once, you don't need to use a condom.
You sure?
Andrew, is there something wrong?
No. It's just that I don't know if we're as good as keeping this a secret as we need to be.
Is it your wife?
No, God, no. It's just that these things have a way of creeping up on you, you know? And adultery is a sin after all.
Come here.
You have 72 hours to take the morning after pill.
I love it when you talk dirty.
Well, I bet you're glad to be rid of that tube.
If that's your way of treating overdoses, it'll be the last one I take.
Should make it standard practice then.
The cancer is in such an advanced stage that it's inoperable. It's spread to the bone marrow. All this is suggestive of a very bleak prognosis.
How long?
It's not easy to say.
I'm sorry, it's not easy for you, Doctor.
Days.
Mama, when are you going home? When's Mama coming home?
Mummy isn't coming home, Daniel.
Why not?
Because Mum's very poorly.
What's going to happen to her?
Mummy's going to die. Come here. I think I want to go home now.
I'll drive if you like.
I don't think so.
Why?
It's not the right time.
It's not important how I got it. What matters is I'm HIV positive, and there's a chance I was when you and I were together.
You tell me now.
I've only recently found out myself. I didn't want to send you one of those anonymous notices. I wanted to tell you in person.
How many more people do you have to tell, Luke?
I know it's difficult news. I just hope your result is happier than mine.
Oh, 2-0. My granny could beat you.
Thought you packed them in.
Yeah, I had. Scissors, want to take on the champ? Rackham. Fighting talk. So what happened with that open and shut case from yesterday?
Open and shut.